challenge is, how do we get the federal government to take care of its business? I happen to be a proponent of a single-payer universal health care plan. That's no reason why the United States of America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. And that's what Jim's talking about when he says everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House.
This is a $2 trillion part of our economy. And it is my belief that not just politically, but also economically, it's better for us to start getting a system in place, a universal health care system, signed into law by the end of my first term as president, and build off that system to further, to make it more rational. By the way, Canada did not start off immediately with a single-payer system. They had a similar transition step.
It's a transitional system building on the existing systems that we have.
Transitional to what?
Well, transitional hopefully because the system currently is such a patchwork of inefficiency that over time I would want to see Medicaid, Medicare, the Children's Health Insurance Program, SCHIP, all those integrated more effectively.
Let's say that I proposed a plan that moved to a single-payer system. Let's say Medicare Plus. Essentially, everybody can buy into Medicare, for example. Transitioning a system is a very difficult and costly and lengthy enterprise. It's not like you can turn on a switch and you go from one system to another. So it's possible that up front you would need not just, I mean, you might need an additional $90 or $100 billion a year.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
There's no denying that part of the solution in the healthcare arena, as we transition and deal with the legacy systems that we've inherited, will probably require some additional money. The public option is not your enemy, it is your friend, I believe. Let me also address an illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system.
My commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. I would hope that we set up a system that allows those who can't go through their employer to access a federal system or a state pool of some sort. But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I happen to be a proponent of a single-payer universal health care plan. A single-payer health care plan, universal health care plan. That's what I'd like to see.
I think if we get a good public option, it could lead to single-payer, and that's the best way to reach single-payer.
And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and leave
Nobody is talking about some government takeover of health care.